Hello, assalamu alaikum. Now the history is constipation. Dalia is 4 years old, presented for evaluation of chronic constipation since her second birthday. She has abdominal pain. Mom reported recent swelling. Otherwise, no health issues. CBC, ultrasonography, renal function, all normal. Take focus history from mother, Mrs. Amina. Hello, good morning. This is Dr. Roxana, one of pediatric doctor here. Am I speaking to Mrs. Mario, mom of Dalia? Thank you for coming. I came to know that you have concern regarding Sarah's Dalia's health condition. So, is it appropriate time? Okay. So, during our discussion, I will take some note. Is it okay? Okay, so before starting our discussion, will you please tell me what is your biggest concern? I'm so sorry to hear. So, how frequently she open her bowel? Is it painful? Is it contains blood? Do you notice? Okay, and do you notice then any soiling? Notice. Okay, and what is I will show the picture of a stool. So what is the shape of a stool? Okay, and do you notice any holding behavior? Yes, and any factor that increase it? How it relieved? How much time she spent uh, in toilet? Is she toileting? Does she toileting? Okay. And what do you do so far for this condition? Is it associated with any tummy pain? Any throw up? Okay, so now let me know about her food habit. Okay, okay, yes. So, do you have any concern regarding her weight? Does she have any kind of fever? What's about her activity? Okay, so please tell me about her sleep. Okay, so Mrs. Mom, now I'm asking you some question of different parts of her body so that I can make sure that everything is okay. Is it all right? Okay. So does she have any weakness in any limbs, any swelling in the back? Do you notice any kind of cough? Any what's about her pee? Okay, and do you notice then any swelling on her neck? Does she has any kind of weather preference? Okay, so let's go back. That does she has any long standing illness? Any need of hospitalization? Any history of the trauma? Any surgery? Does she takes any kind of medication? Does she under any kind of tune? Okay, so now I want to know about do you have any concern when she was in your tummy? I want to know about her bath period. Okay, will you please tell me about the event after the bath? When can you remember when did she first pass her poo? Does she undergoes all of the neonatal screening test, Hill prick test we called? Okay. Do you have any concern regarding her development? Okay. And does she receives all kind of her jabs? Okay. And does she has any kind of allergy to any kind of medication and food? Okay. And will you please describe your family for me? Any long standing illness, any similar condition in your family? Okay, so what do you do for a living? It's a routine question, but maybe personal, that does your income is satisfactory for you? Okay. And you were telling about the recent soiling. So, from when you noticed this? Okay. Okay. Does any event occur following this? Thinking this soiling occurs. In this point, this soiling is very much important. It may be due to any kind of I'm aiding this point, any kind of psychological event that recently she has constipation, but recently developed the soiling because she visited her grandpa's home. Maybe any accidental abuse occurred there, or recently there is soiling because of any psychological trauma, such as father may be shifted from here to outside, so the child is very attached or close to her father, and this separation makes her upset. For this reason she has swelling, but now she developed, she had the constipation, now developed soiling. So it's very important to us to search for the cause of the recent soiling. So after the social history, now the schooling, so which grade now she is, and what about her school performance, is there any kind of bullying, and does school nurse knows about this, and what is the impact of this condition, what's your idea behind this, and what is your biggest worry? Would you please tell me anything that you want to tell me? Okay, thank you for sharing all this information with me, and I wish her speedy recovery. And now the presentation. Today I took history from Mrs. Mariam, mom of Dahlia, who has chronic constipation for 2 years and now swelling for last 7 days. She had tummy pain, but there is no vomiting, no concern regarding her weight and height, but for her, she is fussy eater and less intake of fluid, and in neonatal period, first meconium passed immediately after birth, and family history of constipation is present, and recently she visited to her grandpa's home, and from that she started the soiling and remains keep alone. So considering all these things, it's a case of chronic constipation and soiling due to this there is a trauma. Okay. And if there is no soiling, only the constipation, so the differential diagnosis may be functional constipation, may be a case of hypothyroidism, but here there is no heat intolerance and no recent weight gain. And it may be a case of celiac disease, but it starts from the second birthday. So so I kept in the third position, and it may be cystic fibrosis, but there is no history of cough here. All this I want to consider. So how will you management? I will examine her general well-being and height and weight, neuromuscular examination of the lower limb, and per abdominal examination for any abdominal distension, loaded bowel present or not, back spine examination, and then this is the examination. And investigation, routinely no investigation is needed, but when there is a refractory case, then investigation for celiac screening, thyroid function test, stool examination, urine examination, and radiology is not needed. If there is suspicion of infection or obstruction, then radiology may be needed, and rectal biopsy if indicated. And then what is the indication of rectal biopsy? If there is family history of Hirschsprung disease, failure to thrive, and early onset of constipation, these are the and there is history of delayed passage of meconium. And then the management, non-medical management, medical management, and non-medical management, it change in lifestyle, educate the parents, behavioral treatment, structured regular toileting, and then medical management, first, if there is infection, then there is disinfection, oral disinfection, movicol, if not for 7 days, if not improved, that sena, and review the child after 7 days. But if not improved, then pyrectal sodium citrate macroenema, and if it is not improved, then manual evacuation under general anesthesia. Here we will refer for the gastroenterologist. And after medical management, this is the acute infection and the maintenance therapy with movicol, or sometimes lactulose can be given. And if the child is less than 6 months, so like glycerin suppository and treatment of the underlying cause. And we will involve the multidisciplinary team, pediatrician and gastroenterologist, sometimes if indicated, dietitian, school nurse, community pediatrician, community nurse, and sometimes if available, constipation clinic. And then when we will refer for the gastroenterologist, if there is any organic cause, if this infection is not improved with oral and parectal method, and when there is swelling and abdominal pain despite the treatment, refractory cases, and this are and the difference between the functional constipation and the organic constipation. So there is delayed passage of meconium in case, maybe in case of organic constipation. Failure to thrive may present in organic constipation. Onset is early onset in case of organic constipation. Fecal incontinence and withholding behavior, or inappropriate toilet training, soiling, all present in case of functional constipation. And stool in rectum we can find in functional constipation. And then the question is, what is movicol and how to prepare it. So movicol is laxative, macrogol laxative, and how to prepare it. Prepare over 8 ounce of 8 ounce of water, and doses less than 5 years. Day 1 day dose is 2, day 2 and 3 4 session, and day 4 and 5 6 session, day 6 and 7 8 session in 2 to 3 divided doses. And then this all about the constipation history, recall history. And types of constipation is functional constipation 90% and organic constipation. Organic constipation may be Hirschsprung disease, endocrine cause may be hypothyroidism, cystic fibrosis, metabolic cause, and neurogenic causes, and anal and rectal malformation. Others is the celiac disease, drug abuse, UTI. And one time it came the red flag for cystic fibrosis, red flag for constipation. So early onset of constipation, failure to thrive, neogenic bladder, Husband disease, passage of bladder unless due to anal fissure, acute onset of constipation, vomiting, a sign of systemic illness, anterior displaced anus, anal stenosis, protein intolerance, history of sexual, physical and emotional abuse.